There you go. My Shark Tank companies hate selling on Amazon, but most don't have a choice. About 162 million Americans shop there, and if you want to reach them, you have to play by Amazon's rules. Amazon knows this and takes full advantage, adding and raising fees, and even launching competitive knockoffs. They get away with it because they control the marketplace and because 162 million people shop there, which makes Amazon incredibly sticky. So what does that have to do with healthcare? Insurance companies work the same way. Over 300 million Americans have some kind of coverage: commercial, ACA, Medicare, or Medicaid. Every one of those plans hires a pharmacy benefit manager, or PBM, to run their drug benefits. The biggest PBMs, all owned by the largest insurance companies, control pharmacy benefits for about 270 million Americans. That's a lot of power. And that's also 70% more people than Amazon reaches. Like Amazon, PBMs control the store shelves, but their shelves are called formularies. The list of drugs your insurance will cover, and if a drug isn't on the formulary, it's invisible to doctors and patients. But here's the kicker. Unlike Amazon, which wants lower prices, PBMs actually prefer higher prices. They say they negotiate lower drug costs, but they don't. They auction off access to their formularies to the highest bidders. Drug companies pay the rebates and fees PBMs demand so their drugs can be covered and prescribed. If they don't pay, they lose access to millions of patients and plenty of doctors, costing them billions. These rebates and fees are based on a percentage of a drug's list price called WAC, the wholesale acquisition cost. The higher the list price, the more money PBMs make. Because PBMs are so powerful, that inflated list price becomes the reference point for the entire drug supply chain. Take a hypothetical $600 brand name drug. The PBM strongly suggests the manufacturer set the price at $600, with a 50% rebate and another 10% in fees, leaving the manufacturer with $240 net. Meanwhile, wholesalers buy the drug at that same $600 list price. How many industries do you know where the wholesalers pay the full list price? The three major wholesalers all use the same list price and get paid almost identical fees. There's zero competition, and their fees are also, because they're tied to list price, they make more money when prices rise. Pharmacies buy from wholesalers at about a 5% discount. You'd think PBMs would reimburse them more than their costs so they can make a profit. They don't. When a pharmacy fills a brand prescription for an insured patient, it's often reimbursed less than what it paid for it. And if it doesn't fill enough of those money-losing prescriptions, PBMs or wholesalers can penalize them. It's no wonder independent pharmacies are disappearing. Now, what does the patient pay? If they're uninsured, they pay that $600 list price. If they're insured but haven't met their deductible, they still pay the full $600. That's crazy. We were told that PBMs negotiate lower prices for patients, but they're so bad at their jobs, they can't even get patients a deal that's better than the retail price. But the rebates and fees that they collect on that $600 flow straight from the patient's pocket to theirs. Patients are getting ripped off because PBMs and wholesalers insist on using inflated list prices instead of transparent net prices. Because the whole system is built around list prices, everyone, PBMs, wholesalers, and insurers, have an incentive to keep prices rising, and they almost always do. It's costing patients tens of billions of dollars and forcing many to go without the medications they need. But here's the saddest part. Self-insured employers, states, the federal government, they all keep on signing contracts that lock in this broken system. We blame PBMs, but the real problem is the CEOs, administrators, and state officials who keep renewing these contracts. Every one of them complains about rising healthcare costs while signing deals that make prices go up. Big brand pharma is part of the problem too. They hate PBMs, but still play along. If manufacturers, wholesalers, and payers move to net pricing, meaning the price after all rebate and fees, patients' out-of-pocket costs could drop by half overnight, saving patients billions every year. There's a reason the U.S. has the highest drug prices in the world. We're the only country that uses PBMs. And there's a reason we have some of the lowest priced generics. PBMs can't control generic pricing from companies like Cost Plus Drugs. So what do? 1, count all cash payments towards deductibles. 2, base patient out-of-pocket costs on net price, not list price. 3, separate formularies from PBMs to end their power. And 4, and specialty tiers. It's just an excuse to charge more. Fix that, and we finally put patients, not PBMs, back at the center of American healthcare. Thank you.